What's going on, everyone? Happy Monday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Monday edition of the Pandemic Update for Monday, August 21st, 2023. Health risks can resist at least 2 years after COVID-19, new data suggests. And this is something we've known about for a long time. It's actually called long COVID, and there are a lot of people that suffer with it. And yet again, here's another example of it. And let's read a little further. U.S. veterans' medical records suggest mild infections can still lead to lingering symptoms. We see about this time and time again. We see so many cases where someone has a mild case of COVID, and then as time goes on, the issues tend to mount up, and you see more issues come on, all because they just had a mild case. And as we know, the media, the health leaders, the WHO, the White House, the Biden administration, you name it, are saying, oh, it's mild now, you'll be fine. Well, yet again, here's another study saying, even if you just have a mild case, you could have lingering issues, even up to 2 years later. And I will be tweeting out this study in just a little bit. So if you want to read this, it'll be on my Twitter, and we'll probably post this on the website as well. All right, check this out. So Morris Brown College is actually bringing back a mask mandate, but I actually did a little thread here, 3-tweet thread. And here might be one of the reasons why they're bringing back a mask mandate. Well, you can see here, mask wearing. All students and employees are required to wear face masks. Staff may remove in their offices while alone. Physical distancing. But look at this, number 3. Large gatherings. Institutional guidelines for gathering size must be followed. There will be no parties or no large student events on campus for the next 2 weeks. Gee, I wonder why. Should we keep reading on? Let's go down. Gee, I wonder why. Well, maybe this is what could have been part of the problem. Let's go full screen here. Can you hear it? I mean, look at this. So they're saying no large gatherings or parties. Yeah, because the school did not just have one. Hello. Look what they just did. What is this, August 14th? Who could have expected there to be a rise in cases following this massive event they just had? And, well, you know, I had to include this down there. Yeah, they are. But there you go. All right, moving on. So, yep, mask mandate is back there because, gee, I wonder what could have caused a rise in COVID cases. Could it have been that big, massive event they had? All right, now we go to this. Who remembers America's peakologist? Even he is concerned about the new variant. He has an actual name. It's Dr. Scott Gottlieb. And we won't click and watch this whole thing, but he's actually pretty concerned about the BA 2.86 variant, and he's concerned that it will be more transmissible. And in theme with me calling him a peakologist, yes, he did drop in there when he thought the peak for the EG.5 wave will be. So some things just never end. And sometimes back in the early days, yeah, he was right about the peaks. Other times he was pretty off, saying, oh, the peak's going to come in. The peak never would come. And he's saying that we're doing better right now than we were last year. Hello. We don't do as much testing as we did last year, but he did acknowledge that wastewater is detecting hundreds of thousands of cases a day, so I guess that's a good thing. And then there is this. It's a simple poll question. I did this on, I think I did this on Saturday, didn't I? I don't remember when I did it. It was either Friday or Saturday. I think it was Saturday. Yeah, 5/19 Saturday. Simple poll question. Do you know of someone who has had a health issue since having COVID? We got 1,264 votes. That's quite a few votes. And 89.8% of people said, yes, they do know someone who had a health issue since having COVID. Only 10.2% said no. And yes, there's a whole bunch of comments down here. And yeah, someone says they know someone who has died. Someone submitted another poll within the poll. If yes, how many people? I didn't add that in there. Someone put here, 6 were dead of acute COVID within 2 weeks. I mean, on and on it goes. It's sad. It really is sad. All right, then we have this. India. India registers 54 new COVID cases. This is as of August 21st. This is today. And we learn here that the death tally is at 531,926. And it says here the active caseload is at 1,475. Then we move on to this. We learned that French golfer Victor Ferrez, he's a professional golfer over in France, tested positive for COVID. And I believe he was supposed to be at an event. That's not going to happen. It says here he started feeling sick. He had like a fever, symptoms, and took a COVID test. And to his surprise, positive. See what happens when you take a COVID test? It's even something you think, oh, this is not COVID. Surprise, you got COVID. I mean, that's the way it works. So we'll be adding this to the archive on the website when we get a chance. All right, we got to take a look at air quality for today because it's not great. There's a lot of air quality issues all across the country. I mean, look here in the east as this loads up. You can see here in the east, there's a lot of moderate areas. I mean, I'm seeing some readings here in the 100s. Then we come up to the Pacific Northwest, which is super bad. We have the wildfires, which are ongoing up in Washington. And speaking of, look at this. Even from California all the way up, 200s, 300s, even some isolated 400s. Please, if you have to go anywhere out there, mask up. That is really unhealthy. I would have thought things would be worse in New Jersey, and there's a reason for this. Warthon State Forest. It's infamous for having wildfires. There's another one. The latest update I saw was it's up to 200 acres. That was as of early this morning. It was only 5% contained. That's obviously probably a lot bigger now, and I thought there would be some worse air qualities with that. At the moment, there is not. We'll be following that. I have another channel where I talk about climate, and that is at Climate Data Report. The climate scene right now is just absolutely insanity. We just dealt with Hillary in California, the wildfires ongoing up in Pacific Northwest, the wildfire in New Jersey, we have heat in the plains, and we have a whole bunch of tropical systems, including Franklin. Now there's a tropical disturbance that just developed down in the Gulf. So yes, crazy times. It's going to be busy times for my climate channel over the next couple weeks. So you'll want to subscribe to that down below. That way you're prepared for the latest climate catastrophes and disasters and climate events that are happening. So that's at Climate Data Report. Alrighty, let's get to Walgreens. Yesterday, we didn't know if Walgreens would update. They actually had this locked. Today, Walgreens did update. We're going to do a number of these sites. We're not going to do every state, but we're going to do a number of them, and then we'll do the rest of them tomorrow. The national positivity is 44.9%. Prior week was 44.1%. Here's what's bad. The positivity went up 0.9%. Total testing also went up to 4,001. It's good that there's 4,001 tests on Walgreens, but hello, there's 360 million people here in the United States. We need that number to be even higher, but hey, I'm happy that it's going up. It's sad that I'm happy that it's going up just to 4,000 with knowing how many people there are in this country. Prior week was 3,541. Let's start in the West Coast first. Washington, 40% this week, 42.6% last week. That's a difference of down 2.6%. 50 tests versus 47. Then we come over here to Oregon. Whoa, what's going on in Oregon? 56.7% positivity this week, 26.7% last week. That's a difference of up 30%. 30 tests versus 30. That's a legitimate rise. And remember, wastewater was not all that concerning there, so that's telling me that the next wastewater update, we're going to start to see things getting more concerning out of Oregon. Let's see, can we do California? Yes, we can. California, wow. 53.2% positivity, 51.9% last week. That's a difference of up 1.3%. 434 tests. That's an increase in testing. 395 tests last week. This, my friends, is a legitimate rise. Nevada, whoa, wow. See, I haven't looked at all these sites yet. So, yeah, this is really bad. And I figure we just do it together here. And, this kind of catches your eye, doesn't it? Nevada, 60% positivity. I think this may break the record for highest Walgreens positivity rate we have ever seen. This is atrocious. 60% this week, 44.4% last week, 15.6% difference. 65 tests versus 54. Yeah, it's a legitimate rise. What's going on in Utah? Okay, Utah's down. 30.8% positivity this week, 56.3% last week. Difference of down 25.5%. 13 tests versus 16, so that is a legitimate drop. Then we come down to Arizona, 44.6% positivity this week, 46.7% last week. That's a difference of down 2.1%. Then we come over here to New Mexico, 41.7% positivity this week, 52.9% last week. That's a difference of down 11.3%. 12 tests versus 17 tests. So testing's down, but hey, the positivity's down too. So that is a drop. Colorado, 32.7% positive this week, 25% last week. Difference of up 7.7%, and testing's up 52 versus 40. That, my friends, is a legitimate rise. Is Kansas a legitimate rise? Kansas did not report last week. 28.6% positivity last week, 14 tests this week. Zero positivity last week, and 28.6% is the number for this week. Then we come down to Oklahoma. I'm surprised we get anything out of Oklahoma. 45.5% this week, 47.4% last week. Difference of down 1.9%. 11 tests versus 19 tests. So that's a drop in testing. Not good to see that. Texas is an increase in testing. 46.1% positivity this week, 48.4% last week. Difference of down 2.3%. Testing is up 928 versus 834. So that is a slight drop. Taking a look at Louisiana. Wow, this is not good. 50% positivity this week, 7.1% last week. It's a difference of up 42.9%. 18 tests versus 14. Yes, this is easily a legitimate rise. Let's do a few of the Great Lakes states, and then we will move on. Iowa, 18.2% this week, 10% last week. Difference of up 8.2%. Total test 11 versus 10. So yeah, that is a legitimate rise. And then we come over here to Minnesota. 43.9% positivity this week, 28.1% last week. That's a difference of up 15.8%. Testing is down 41 versus 57, but you know what? I think we are going to call this a rise as well. Wisconsin, 36.2% positivity this week, 31.1% last week. That's a difference of up 5.1%. 47 tests versus 45. Yes, that's a legitimate rise. Wish I could show you Illinois, and I guess we can. We're clicking on it. It's coming up white, but guess we can still show it to you. And for Illinois, 42.8% this week, 43% last week. It's just a small difference of 0.2% lower. 194 tests versus 165. That's still a very high positivity rate, so this is still at high levels. And yep, some of these other ones, yep, 0, blank, blank. And should we do one more? All right, we'll do one more. We'll do Michigan. Then the rest of these to the east we will do tomorrow. Michigan is at 41.3% positivity this week. The prior week was 31.8%. Difference of up 9.5%. Total test 46. And the prior week was 22 tests. So yes, that is a legitimate rise. All right, moving on now. If you did not see our wastewater update, we did a wastewater update yesterday. It is 2 videos down below. As you can see here, most regions of the U.S. are rising for wastewater, with exceptions to the Midwest. We do think that is going to get corrected in the coming, probably this upcoming week. All right, moving on now. We want to take a look at hospital ER visits, and you can see here, it's up in the majority of the country right now. Do I need to say any more? We will get some new admission data tomorrow. Last week, or in the last update, there were 10,320 admissions. I think this updates again tomorrow. And let's see, what else do we have here? We don't have anything on this day in COVID pandemic history. We do have this. EG.5 is at 20.6%. FL 1.5.1 is at 13.3%. today, and I wanted to show this to you. Someone brought this to my attention on my website, and this has to do with Chicago. This is the Chicago COVID dashboard. We'll show it today, then we'll show it again later in the week when it updates. And the positivity rate for COVID in Chicago right now is at, let's see, I have to check here. It is at 9.4%. So here it is right here. It is going upward. The average daily number of tests is also going upward as well. Let's click on the Chicago summary. Let's see here. It shows here, if we look at the charts, I think we can see the number of deaths that they had. It doesn't matter. You can see here all the data here in Chicago shows that confirmed cases, it's going up. Daily average of hospitalizations is going up. Hospital bed use is going up. Emergency department visits, they're up almost 1%. So yes, things are starting to unfortunately rise even greater in Chicago. We'll have another update on this later in the week. I'll familiarize myself with this dashboard a little bit more. All right, New Jersey. Today, 50 out of 70 hospitals reported. While that's better than yesterday, we're still missing 20 hospitals. And with missing 20 hospitals, it went back up to 217. I suspect when all hospitals report, it will be well over 300. 8 people are on a ventilator and still 30 people in the ICU. So that number's not great either. I think that number's going to go up a lot when we get more data as well. Moving on to this is the Philadelphia Fire Department for Philadelphia EMS incidents. 768 EMS incidents occurred on Sunday. That is below the 800 threshold. And let's do a live look in at Montgomery County. Wow. Respiratory difficulty, stroke, dizziness. There's 13 active calls right now. Let's see the lagged version. The lag version, I have to refresh this. The lag version does show 26 incidents. It was at 31 earlier. And taking a look at Chester County, what's going on there? Yes, not good. Ooh, cardiac arrest. There's a whole bunch of things going on there as well. Let's take a look at what's going on in Maryland. You can see here there are some yellow and red diverts going on in Region 3, I believe this is. Then we go over to Region V and take a look here. Yes, in this region as well, there are some yellow and red diverts at this time, so that's not good to see either. New York State added another 767 COVID cases. The positivity rate was 14.6%. That's higher than the 7-day average of 13.8%. And they did end the week last week with higher admissions and higher hospitalizations. I'll show you the hospitalizations. It's probably going to refresh on us. We will get the start of the new week tomorrow. That's very important. And they ended the last week at 926 people in the hospital, 96 people in the ICU. I suspect that's going to be over 1,000 come next week, which is, yeah, that's not good to see. And let's do a little brief international update. We don't have anything else for you today. Let's just take a look at a couple countries around the world. We see Australia, 54% increase in cases. Deaths are down 62%, so that's good to see. Belgium, cases are up 72%. Ireland, cases are up, whoa. Okay, we got a problem with Ireland. Cases are up 72%. And then we come over here to deaths. 567% increase in deaths. 199 versus 20. What's this all about? That is a huge 1 week increase in deaths. Chile has an 18% increase in cases. Thailand has a 19% increase in cases. And then we come down here to, let's see, where Norway, 16% increase in cases. No deaths reported. Denmark, 32% increase in cases, 3 deaths versus 5 reported. Then we come over to Poland, 50% increase in cases, and 5 deaths versus 2 deaths. So, some concerning countries out there. Alrighty, folks, that does it for today's pandemic update. We'll have another pandemic update again tomorrow with the rest of the states on Walgreens. If you enjoyed this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs a reminder that the pandemic's not over and that even a mild infection can cause long-term issues, by all means share this with them. I will see you all again next time. But until I see you again next time, stay safe everyone and have a great afternoon.